Okay, I'm going to explain who's who in this scenario, and I will be the social worker therapist, Karin Sack, and the roles are going to be Peter as the father, Millie as the mother, Jordan is one of the sisters in this scenario. She is the sister to Allie, who is the heroin addict. So this is a family session, and they are coming here in seek of help. Okay, and ready. Hello, everybody. How is everybody today? Let me introduce myself to you first. My name is Miss Karin Sack, and I would like to see who you are. If you can tell me your names.
Peter.
Okay, Peter.
Millie.
Millie.
Jordan.
Jordan.
Allie.
Allie. Okay, so Peter and Millie, you are the parents of these two girls, correct? So these are your daughters. And how old are you, Jordan?
I'm 16.
Okay. And Allie?
I'm 18.
Great. All right, so I wonder what has brought you here today. Can anybody tell me a little bit about that?
Well, we recently found out that our oldest daughter, Allie, has had some bad habits involving drug use, and we think the best thing would be to have family therapy and work through this. We care about her, even though she doesn't think we do, and we want that for her.
Okay. Okay.
Right?
Right.
Okay. Okay, so just wondering here, how long ago did you find out about the drug use?
About a couple months ago.
Yeah.
Probably.
Yeah.
Yeah, Allie was a cheerleader, and she
Okay.
got cut off the team because she was starting to miss practice and started hanging out with the wrong group. And she's always been really good, and so Peter and I gave her more like lenience and like freedom, and so we would let her go hang out with her friends because we trusted her and we didn't follow up with her, and then she slowly came home and was active.
Yeah. So we started seeing signs of heroin use, actually.
I see. So why did you suspect that it was heroin in particular? What were those signs? Did you notice that she had the substance on her? Was she carrying it on her, or did she have it in her purse?
So we noticed different signs, physical signs, just like the way she was acting, her attitude changes, and I had spoken to a good friend of mine who is. And I had spoken to a good friend of mine who is very familiar with drug use, and so we suspected it was heroin, and we confronted her about it. She yelled at us, and then she told me there was, and that's where we came to today.
Okay, just because someone sometimes uses drugs does not mean that they have a drug problem. Okay, I'm 18, I'm an adult, I'm having fun with my friends. Okay, I'm fine, I'm completely fine.
Yeah, but also you live in our house, and heroin's a pretty hard drug, and we don't want you out of our house, but you do live in our house, and as long as that's the case, we want.
Okay, only for like 3 more months until
And
college.
we don't want drugs in our house because when I went to go make your bed up the other day, it was slid up under your mattress.
You were snooping in my room? Are you serious?
Well,
Are you serious?
the
After
laundry
all,
needed to get done because you don't do
It's
it.
our house. Yeah.
okay, I need privacy. I am 18 years old. I'm about to go be on my own for the rest of my life. I'm fine, okay? My grades are still okay. Yes, I got cut off cheerleading, but like, I'm gonna graduate and I'm gonna go to community college. And like, I'm fine. I just wanna have a good time.
So yeah, that's why we're here today.
We don't have
You
to do
can
that.
hear the conflict.
Okay. I'm wondering, Allie, then, who is it among your friends that encouraged you to start using? Is it because it makes you feel good when you're using, or what is it about the drug itself?
I mean, this isn't some like peer pressure, corny situation. I mean, I like to have fun. All of my friends do different kind of things for fun, and I chose to do this. It's a good time, and
Why
I
can't
enjoy
you
it.
be more like your sister?
I knew you were going to bring that up. I knew
I mean,
you were going to.
She does exactly what she's supposed to do.
Maybe I want to be my own person. Maybe I'm not my sister.
Yeah, but you could follow some more positive behaviors from her.
Maybe I don't want to.
Because she's here to help you, right? Yeah.
Yeah, she really looks like she's here to help me.
So Jordan, how do you feel then about what's going on with your sister?
I just don't get it. I mean, she causes so many problems in our house, and I just don't understand.
And it affects her friends too. Her friend group, because they don't feel comfortable.
They don't want to hang out with me because they feel like their parents are going to think I'm a bad influence because she's my sister. Everyone knows she does drugs.
Maybe I'll just leave this and a huge burden on the entire family.
Which is not what we want to happen. We don't want to kick her out. Just to clarify that.
Okay. So Allie, you said that you're ready to go to college,
Yeah.
correct? And you will be graduating from high school. Okay. Okay. And so that's what, a few months to go, 4 or 5 months to go to
Yeah.
complete high school. So I would just encourage you to remember that you do live under your parents' roof. You're still there, and you're still in school and living with them. I guess I would ask you this question now. Have you ever considered harming yourself?
No. I'm very happy. I just like to party with my friends. And this just seems like my parents getting someone else to tell me exactly what they think. And nobody cares what I think.
Okay. So, do you feel comfortable with your friends, perhaps more so than you do at home with your parents and your sister?
Of course I do. Because this is what I see when I come home. It is, why can't you be more perfect? Why can't you be more like your sister? With my friends, I can be myself. I can do things that I want to do and be a normal person. And you know what? Maybe my friends are perfect. But at least they care about me.
Yeah.
Okay.
So what do you think?
I'm not really here to give my opinion, honestly. I'm here to suggest that we continue with sessions with the goal of Allie discontinuing her use of the drug. Perhaps rehab would be an option. I don't know if mom and dad would consider that.
I still think she wants it though.
No.
Yeah. And I don't want to pay for it if she's not willing to do it.
I don't need rehab. I'm fine. I'm completely fine. I don't need rehab.
Okay. Okay. Tell me then what it is that made you decide to use in the very first place. Was it because you were having problems at home with your parents and your sister? Was there something that occurred prior to that? Can you maybe tell me more about why you used?
The first time I used, it wasn't that long ago. But it's not like my parents abused me or anything. I just think the more uncomfortable I felt at home, the more comfortable I felt with my friends, and when I spent more time with them. So I guess I'm sure my friends encouraged me in some ways, but it was my choice. It just seemed like something fun.
Drugs are not.
Okay, well, no, Mom. Okay, well, I'm having fun, and I'm fine.
Maybe you can do something with it.
Well, we've kind of tried everything. We tried to talk to her, and I try to remain unbiased. I try to remain on anyone's side, but except I want her interest. But when I have to say something and I have to make a rule, she doesn't want to listen to the rules, and she doesn't want to listen to what I have to say. And so I'm pretty much at ends meet. And if she wants to leave, she can leave. She is 18. That's true. Even though I personally don't want that to happen, and I think we don't want that to happen. But She doesn't listen to anything I say. You don't listen to anything I say.
Maybe she needs to go.
What-
Maybe she needs to move
Well,
out.
what's the big deal? What I'm doing? I'm graduating. I'm already
And so
accepted into college.
this is the main problem. She doesn't even
What's the
realize it's a
problem?
problem.
Like, what is the
Exactly.
problem?
That you're using heroin.
Like, if you guys hadn't found it, you would have never known. I'm like so responsible.
Well, we did notice signs. That's why we got to this point.
That's why we're here.
Like what?
Like, okay, the coming home super late, being super irritable,
Drugs under your mattress.
drugs. Drugs.
Yeah.
I was just trying to make her bed.
So that's the issue. And so I was told that counseling and family counseling can help us work out something. So that's
It was
what
his
we're
suggestion, which
that's
I
what
wanted
we're-
to come, but
Okay, right. I think in the end, though, we have to recognize that it is up to Allie now that she's 18. You certainly, as has been said, has an option to have her leave the house, but you both made it clear you don't want that to happen. So who would be sponsoring her to go to college? Is that she paying her own way, or are you putting her through college?
if she continues down this path, she will be paying for it by herself, which I don't know how she will because she is financially heavily dependent on me.
You guys are just like
So, Allie-
completely blowing this out of proportion.
So you probably can't even pay for community college unless you want to take out loans.
Maybe I will. If you guys want to keep me from reaching my dreams just because I party a little bit, then yeah, maybe I will.
She used to want to be a doctor. And now when you ask her, I don't know what she wants to do.
Okay.
Yeah, because you don't
Okay,
ask.
Allie.
Mom.
Okay. Allie, how do you feel about what your parents have said? There's some criticisms here about your drug use, and I'm wondering if you think it's a possibility for you to respect your parents' wishes a bit more and show them some respect in following what they're asking you to do, the rules of the house. They obviously want to see and do what's best for you. So how do you feel about their wishes?
It doesn't really seem like what's best for me. The only thing they talk to me about are things I'm doing wrong. They don't even know where I want to go to school. They didn't even know I was accepted to college because I didn't tell them. And they didn't ask. She didn't even know. She didn't even know what I wanted to do. You didn't even know what I wanted to major in anymore because you haven't asked in like 2 years.
Is there a time?
Is 12:34. That was about, and you started at 21, so that was 13 minutes.
Okay, what's that?
Oh, we were like 4 minutes over.
Okay.
Is that good?
So we're
Drugs
just
under the
gonna.
mattress, man.
Are we just gonna?